Good morning, good morning, good morning, and welcome to the Great Lakes Health Radio program on Power 96.5 FM and 1080 AM. I'm your host, Francesca Messiah from Kaleida Health, Manager Workforce Development. And I want to thank you for taking time out from your early morning to spend an hour with us. The first part of our program today, we'll be talking with Ben Casper, talking about preventing childhood injuries during the summer. And our second part of the program, we'll be talking about employment, job opportunities, careers with Angela Mosteller from HR and Talent Acquisition from High Point at Michigan and DeGraff Medical Facility, long-term care. Who is Kaleida? I know I say this every week. Kaleida, we're the hospitals. We're Buffalo General Medical Center. We're Gates Vascular Institute. We're Oishei Children's Hospital. We're Millard Fillmore Suburban. We're Visiting Nursing Association. We're High Point at Michigan. We're also DeGraff Rehab Facility in North Tonawanda. We're Great Lakes Cancer Care Collaborative, offer all cancer services. We have clinics in Buffalo, north of the city, south of the city. We are in Olean and Bradford, Pennsylvania. We are Kaleida Health. So we're the hospitals, the largest healthcare system in Western New York. And we have over 600 positions available, and we would welcome you to join us at Kaleida Health. Well, for today, we have a great program today, and I'm going to introduce our first guest, who is not a stranger to the Great Lakes radio program, because his area and the colleagues and his network are all around children safety. Your children, your grandchildren, your foster children, your godchildren. Good morning, Ben Casper. How are you?
Good, Francesca. Thank you for having me. How are you doing?
Oh, wonderful. And our topic for today, and Ben's title is Injury Prevention and Outreach Specialist. It really doesn't complete everything that he does, because he's just a wealth of information when it comes not only from childhood safety, but safety including physical safety as well as wearing your sunscreen. And our topic for today is we're going to talk about how can we prevent some of these childhood injuries during the summer. And Ben, the first question, during the summer, do childhood injuries increase? And if yes, can you please provide some examples of what are those injuries?
Yeah, absolutely. Great question. So injuries we generally see because we are a level one trauma center serving the 8 counties of Western New York. And we do see an uptick in injuries that do occur in between Memorial Day, which is coming up, and Labor Day. So I think a big reason behind that is, well, the weather is nice and we want to get out there and we want to be more physically active. But by doing so, we want to make sure that we are taking the necessary safety precautions just to keep our kids safe, our grandkids safe, our siblings safe. And some of those injuries that we do see are pedestrians, so people that are just walking in the street or around the street in area, getting struck by vehicles. We also see an uptick in bicyclists either having accidents or being struck by a vehicle. Along with falls. And that could range, and a lot of that's dependent on age group where the risk factors are, with the young ones that have the physical ability but don't really understand the repercussions of their actions. They can fall downstairs or they can push on a screen from a second story window and fall. So there's a lot of injuries that kind of occur in or around the household. Actually, about 1/3 of our injuries, when it revolves around pediatrics, happen in or around the household itself. And along with pool safety, if you have any pools or anything like that, or access to water, you need to make sure that we educate our kids. in order to kind of prevent those injuries from taking place. And I'd be happy to share with you some things that we can do to help prevent those injuries as well, if you'd like.
And we talk about educating kids, but you know what I see, and I really find it disturbing, but it's I believe it's a fact of life. You're educating the kids, and it's kind of leading up to the next question. But we have teens and up who are on their cell phones, who are texting, taking selfies, play, all these different live chats and such. And I know that even though they are there to watch over their, like I said, their children, their siblings, their grandchildren, foster children, can adults do a better job at paying attention when watching younger children? And what should they do? Like, what are some of the things? This is not just this is about adult. This is about children, but we can't leave out the adult factor. So, what can adults do to do a better job at preventing some of the injuries in the young children?
Oh, that's a great question. Technology is a wonderful thing, but sometimes it consumes us all at times. And I always encourage people to try to be in the moment. Experience those adventures and those activities and those things that your kids are involved with by putting your cell phone down. Encouraging your kids to not have electronic devices and not be on them for prolonged periods of time. Be there in the moment, because a lot of times it's easy to kind of get lost in your virtual land with these the multiple different platforms. So they're entertaining, but especially in Western New York, we don't get the best of weather for all that long. The summer months are beautiful, so enjoy it and put down your phones, because if you're present, you're there. Then you can witness something that maybe looks like there's potential for a possible injury. And you can maybe prevent that before it takes place. If you have like a toddler that is, like kind of pushing on a screen or something like that, or you have a younger child that can crawl quite well, but not quite walking yet, and is, kind of by like a stairway or something along that line. If you have kids that are, you're cooking, it's nice to have that, like we actually had a little perimeter down where this is a kid-free zone. You can play, but you're not going to play right around the stove because we're cooking. And just being aware and basically just not being distracted is a great way to help prevent injuries in around household and pretty much anywhere.
Mm-hmm. Yeah, because many times, like if your child is on a swing, let's say you're at the playground or on the slide, and you're trying to show someone what you're wearing, or you're trying to do a selfie or one of those videos, you can't. The phone has to be in your face for that to happen, and which means you can't be watching the child, whoever you're supposed to be looking after. So just to say that. How about stroller, car seat safety? Give us some tips on, is it if someone is a 2-year-old and they don't have the car seat, let's say the car seat's in another car, is it safe to hold the child is it safe to hold the child in the front seat? Let's talk a little bit about car seat safety and even stroller safety. How important is it that your child is, for lack of a better word, strapped down in that stroller?
Oh yeah, no, that's a great question. So I'll talk about, I guess, car seats first. We have a lot of great programs, including ourselves at Oishei. Actually, before I just jumped on here, there was a mother in need of a car seat for the next step up for their 3-year-old, and so we're able to help them out. There's a little educational component. And we are able to answer any questions, give them a free car seat. There's a lot of great programs out there in our community. We work in conjunction together. And so we're able to kind of provide seats for those that maybe have some financial difficulties. That's a common occurrence, especially right now. And under no circumstances really should you ever try to self-restrain your child by like holding them in any seating position because, well, the amount that they weigh multiplied by the amount of or the speed that you're going or go to the deceleration that happens, you multiply those two together and that's the amount of force that you need to restrain that child. So say you're going 40 miles an hour and you have a 20-pound kid or something, you're going to need, 800 pounds of force to restrain that child. That's a lot of force. And if you look statistically, you look at the numbers, victims of car accidents are always throughout the whole year within our top 5 injuries or the mechanisms of injury as we kind of refer to it at the trauma center. So it does happen. And we've made some vast improvements with safety in and around vehicles, including car seat safety with improvements in technology. So we also offer here at Oishei Children's Hospital, and I'm sure you'll share contact information afterwards. We offer free car seat checks for anybody that wants to make an appointment just to make sure that their car seat's installed correctly, because over half of all car seats in some way, shape, or form are installed incorrectly. So you just want to make sure you have the right the right equipment, you're familiar with how to use it to keep your kids safe, especially with the car seats. And when it kind of comes to the strollers, you want to make sure too, because I know today it's quite warm outside. Summer is here. It's in Buffalo. It just flicks a switch and here we are. You want to make sure that, you don't have your kiddo that's in direct sunlight for a great period of time. They have very fair skin, at this time. And it doesn't matter, even with different darker complected individuals, you can still get sunburn. So you want to make sure that you're using the appropriate sunscreen on your children. And when it comes to strollers as well, you want to make sure that you are, you have the appropriate stroller for the size and weight of your child. Especially with young infants, the birth to 4 months of age. They can't go in a traditional upright stroller necessarily because they don't have that head control, and that can become an airway problem. So you just want to make sure, and I'm not trying to scare anybody, I'm just trying to give some of the the precautions that you could take to read those instruction manuals and the directions there to make sure that you have the right equipment for the right child.
And you know what? I'm going to ask you, you talked about that Oishei has free car seats and they have programs for car seats and car safety. Can you just provide that contact information? If you could do it slowly and do it twice.
Absolutely. I'm kind of always on the move. So the best way where I always kind of have access to is my email address. And that's going to be B as in boy, KAS, P as in Peter, ER1, just the number, at KaleidahHealth.org. So it's B Casper with a K. So it's like the ghost, but with a K. The number 1 at KaleidahHealth.org. Otherwise, I can also be reached. You can leave a voicemail if I'm in or out, or if I'm out of the office at area code 716-323-2624. Again, that's 716-323-2624.
Thank you. Okay, moving on. Bike safety prevention. I told you this show is about childhood prevention, and when we have adult prevention, bike safety prevention. Is wearing a bike helmet necessary for children? And if yes, is there a certain age? And I'm also talking about not only about children pedaling their own bike, but like yesterday, for instance, I saw an adult with a child on the back of their bike. Are helmets necessary for children if they're actually pedaling the bike themselves or the tricycle, or if they are a passenger of someone on the back of the bike?
Yes. So the generalized answer is yes to all of the above. And because you only have one brain, and you want to make sure that you're keeping that as protected as possible while enjoying going ahead, riding your bike, being a passenger, even on the backs of those other bikes, because, accidents happen. And, fortunately enough, we do have a level 1 trauma center located conveniently in downtown Buffalo at Oishei Children's Hospital. But we'd like to prevent those injuries from occurring, or at least to minimize them. And I think that it really goes a long way to encourage the parents too. So I actually go and I have we distribute about 250 bike helmets locally every year, thanks to an endowment through Kiwanis, and so we're fortunate to do that. But we also provide some bike helmets to the adults, because you have to lead by example. And I know that that's true. When I was growing up, the do as I say, not as I do, that really didn't hold a lot of water. It was, if you lead by example, you show them the way. Whenever I'm biking with my kids, I make sure that I'm wearing a helmet, because then they realize it's like, okay, well, this must be an important feature. And to kind of go beyond that too, teaching the appropriate rules of the road. You're riding with traffic. And if you're ever going to deviate from that, you have to have eyes on where you're going, because a lot of times kids can have, tunnel vision, and adults too, whether it's distraction or, but just being aware of your surroundings, especially if you're going to make any abrupt movements. And that even goes with, pedestrians that are walking, the looking both ways and then looking back again both ways. Just to make sure that you're clear, try to always cross at crosswalks and or at lights, and look for appropriate signage, and wear things that are visible, especially with the warm weather. Especially with that warm weather later in the evenings, and it stays light out later, so people are usually out and about a little later. But at dusk, when some people have their headlights on, some people do not, you want to make sure you can do anything possible to just make yourself visible on the road. That will help a long way as well.
And I also find that there's more sophisticated equipment. I don't know how much it costs, with lights, people who can wear like a helmet. You can buy helmets now with lights. Make sure you have reflectors on your bike. But a lot of things, in terms of making sure a bike safety have become, bike safety reflective equipment has become more sophisticated. And not just bike, I'm going to say walking your dog. I know one day I was, driving, turning the corner, and all of a sudden there was someone crossing the street, but they were wearing black. That black, I love black. I love wearing black all the time. But if I'm outside, or if you're outside and it becomes dusk, try and find something bright. But again, there's reflective tape. You don't even have to buy anything new. You can go to several stores that probably sell bikes or sell hunting equipment. Look for that reflective tape, and put that reflective tape on your baseball cap. Put it on the back of your shirt, because it's so important when those headlights hit that reflective tape, that they see you and they don't accidentally hit you or the child.
Oh yeah, 100%. And for any parents that might be listening, just next time you're driving in the evening hours, and you can see the reflection in like the pedals. A lot of those things have been incorporated on the bikes already. But when you're driving, look to see like, whoa, it's like, oh, I didn't even see that person. They were wearing dark clothing, and didn't even see them till I was right on top of them there, or not literally, but like I was approaching them, and and in comparison to someone who has those different things. And then the nice thing nowadays too is that the technology has been there for a while, so it's usually at a pretty reasonable price point to be safe. And that's another thing that we really pride ourselves on at Oishei Children's, and within the trauma department and injury prevention, is we make every effort to supply these certain goods, these different things, to people that maybe can't afford them. Even if I'm not present at a community event, if somebody reaches out to me, I'll make an effort to get them the appropriate gear that that's needed to be safe. And a lot of our community partners. We fund a fair amount of different services, different areas, just so we can provide it out there, even if we're not necessarily representing from Oshai to the T. As long as we're getting it out there in the community, that's a win in our books.
Yeah, and I have to say, I know you're not available to be under the Juneteenth tent on June 15th, the ECMC collided tent. But maybe we can get one of your colleagues, one of your partners, to possibly be there to give out a few bike helmets. That's always a hit, always a hit. But moving on, you talk about the trauma center. Now, the trauma center, if you could just share a few minutes with us, with our listeners, what is the trauma center, and is there more? Are there more patients seen during the summer months with the trauma center?
Yes. So, like I said before, like we're a level 1 trauma center, which is a verification that's granted by the American College of Surgeons, and it's the highest level of verification that you can obtain to be a trauma center. So we're well equipped with very many services that are available to the children, and we serve traumatic patients up until their 19th birthday, so 0 to 18 years of age, and at least in that capacity. And we're just very fortunate to be able to do that. And as part of that, we have an injury prevention specialist, which is me, and so that's where we kind of reach out and do whatever we can, find common gaps that kind of occur. And yeah, during the summer months, we see a tremendous uptick in our orthopedic injuries, just because people are out there and they're having fun, but we just try to make it so they can do it in a safe fashion.
Okay. All right. Now, lastly, our last area we're going to talk about falls. You say orthopedic. So do those, I'm just saying, do those two go hand in hand in terms of falls? And what should you do if your child falls? We've all fallen as children, but for the most part, we got up. What if your child does not get up, does not respond right away, says they're alert, but says they can't get up? Should you call the doctor's office, go to the emergency department, or call an ambulance? You have about 4 minutes.
Well, so a lot of it just there's a lot of factors that depend, but whenever you're in doubt, and somebody's not either responding appropriately, is unable to move, anything along that line, call 911. I've worked as a paramedic in the streets of Buffalo and the surrounding areas for over a decade. And it's not like as soon as you call 911, you're going to get a bill or anything like that. You'd rather call and have, trained medical professionals arrive and not need them than the alternative, right? So if it's bad, or if it's perceived as being something that's like, ooh, this is significant, call 911. Get the wheels turning, because it's always better to call and maybe potentially not need it than need it and need the resources and have it be delayed because of waiting. So it's always nice to err on the side of caution, 100%. And that's why, and also like the EMS personnel are able to consult our physicians in the emergency department too, with any obscure case that maybe doesn't fit the general pathways that they're used to following. So we have a really nice comprehensive medical system that expands outside of the doors of Oshai Children's Hospital and kind of to the community in that fashion as well.
Now, also, when you're calling now, let's say your child has fallen, having difficulty getting up, or has hit their head hard, and your car, you need gas, your car's not working, your car's in the shop. Can that adult ride, that person over 18 ride in the ambulance? Can they ride along in the ambulance?
Yes. So it's ultimately, as long as that person doesn't basically aren't perceived as being a threat to the crew, which the majority of cases, that's not the case. And then, a family member is not only allowed to, but encouraged to ride along because they have a lot of pertinent information regarding the child, whether they have a previous medical history or whether they've had, X, Y, or Z that has happened to them in the past. And, it's always nice to have a caregiver there because that also can help soothe the child as well because they are around familiar faces.
Yeah, I was going to say definitely help soothe the child. We have about a minute and a half left. What's something that you'd like to share that we haven't covered?
Well, I just hope that everybody enjoys the summer months, and it's been a long winter. I swear the winters get longer and longer every year that goes by. But I hope that everybody enjoys themselves in a safe fashion. But if things do happen, just know that we're here for you 24/7 at Oishei Children's Hospital. And go Bills.
Go Bills. And what's that number to call or email you for about free car seats and other car seat information?
Yes. So it's going to be bcasper1 at kaleidahealth.org. And that's B as in Benjamin, KASPER1 at kaleidahealth.org or 323-2624. Again, that's area code 716-323-2624.
Okay. All right, Ben, we are out of time. I want to thank our first guest, Ben Casper, injury prevention and outreach specialist, Kaleida Health, Oishei Children's Hospital. And listeners, don't go anywhere because we have part 2 coming up within the next 30 seconds. Thank you so much, Ben.
Thank you, Francesca.
And now on to part 2. And you know what? This year, I'm just really trying to focus more in the area of employment and careers. And so for today, again, I'm your host, Francesca Messiah from Kaleida Health, Manager, Workforce Development. And I appreciate you listening and staying with us for the second half hour of the program. Or if you're just joining at 7:30, welcome, welcome, welcome. And our guest for today is Angela Mosteller. And Angela is HR, Human Resources, and the Long-Term Care Talent Acquisition Partner, which means she's responsible for hiring. And tying it into our topic for today, which is careers and employment in long-term care. So Angela is HR, Human Resources, Long-Term Care Talent Acquisition Partner, responsible for hiring at High Point on Michigan and DeGraff Skilled Nursing Facility. Welcome, Angela. How are you today?
I am doing well. Thank you for having me today.
Oh, wonderful. Angela, I know you've been on before, and I forgot when. However, I know a lot of people when I'm in the community, people still don't understand what is long-term care. So if they're interested in this area of going online, applying to Kaleida, what is long-term care? And could you provide some examples of the services that are needed at Kaleida Health long-term care? It's a long question. And what are the hours of long-term care facilities?
Absolutely. So a lot of people are not aware that Kaleida Health has 2 long-term skilled nursing facilities, which include High Point on Michigan, which is located in a downtown Buffalo Medical Campus area, along with DeGraff Skilled Nursing Facility, which is located in North Tonawanda, right behind DeGraff Memorial Hospital. Long-term care and short-term care, what we do is we take care of the needs of those who are not physically capable of taking care of themselves, or whether they're here for intense physical therapy after, a knee replacement, hip replacement, motor vehicle accidents, or if they're just in need of strengthening after being hospitalized for quite some time. So we provide services to those who need that extra assistance in their everyday routines.
And what are the hours of a long-term care facility?
Well, this is a 24-hour facility, open 7 days a week, 365 days a year. So we have 24-hour continuous care for our patients, residents, and the children that we service.
Yeah. And I also want our listeners to know that all of our hospitals are also 24 hours a day, 7 days a week. We don't close on Christmas or any of the holidays because we're providing services. What are some of okay, so if someone is looking at the Kaleida website. So if they were to go to Kaleida Health and type in, and then when the bar comes up, type in careers, they're looking at that site. How would they apply for a job, and what type of jobs are available in long-term care?
Absolutely. So we encourage people to visit our website, which is www.kaleidahealth.org/careers, and take a look at all the career opportunities that Kaleida Health has to offer. You can punch in codes such as High Point to Graph, Buffalo General, or for the long-term care facilities, that the positions that we recruit for are nursing personnel, which include licensed practical nurses, registered nurses, New York State certified nursing assistants. We also offer a paid CNA training program here at High Point on Michigan for those who are pursuing career opportunities as a certified nursing assistant for both High Point on Michigan and DeGraff Skilled Nursing Facility, which is located in North Tonawanda. We're also a testing site where we test the CNA trainees to become New York State certified and have a career opportunity within our long-term skilled nursing facility. Those are just to name a few of the positions that we currently interview for. We also have entry-level positions such as nutritional food service aides and environmental services. We have physical therapy positions for physical therapy, occupational therapy, respiratory therapists. We also have administrative positions available here at our long-term care healthcare facilities.
What if, a lot of times in the community, someone may say, I'm interested in a position in dietary or a position in environmental services, which are positions that are available at High Point and DeGraff. If someone has been, let's say this person is 18, and because that's when you can apply for jobs at Kaleida, you must be 18 in order to be hired. But for the past 8 years or 10 years, because they're the oldest member in their family, they've been cooking for their siblings. They've been making sure that their siblings are out the door in the morning for school. They're cleaning up around the house after they get home from school. How does that type of information, is that valuable information to include on your resume?
Absolutely. Even though experience is preferred, it's definitely not required. There's always people seeking different career opportunities, to find their niche. We also offer opportunities for them to volunteer here at our healthcare organization, where it allows them the opportunity to work alongside of the healthcare professionals to see if that's a career path that they're interested in pursuing. If you're taking care of someone at home, whether it's someone who is elderly or any family for that manner, you could definitely put that in the resume, letting us know that you have some experience taking care of others, or that customer service that we're looking for.
Right. And you said the key word, the word is experience. And I have to admit, how I really became in touch with that type of information, things that you do around the house. It's not just housework. It's when I was in a organization when I was active with the organization called the Junior League. And that's one of the things they talked about, was turning your life experiences, things you've been doing for years at home. You could be taking care of an elderly loved one who is unable to move around, and you're that caregiver. Please put that type of information in the section of the resume that talks about experience, because it is experience, and never discount the experience that you're doing for your loved ones at home. I just had to say that. Positions, what are some of the positions that need immediate filling?
Currently, at this time, we are looking for nursing personnel. Nursing personnel includes registered nurses. We do have open positions for nursing supervisors, along with unit managers. We also have weekend warrior positions, and weekend warrior positions is for those who are looking for just weekend positions, that'll free up your time during the actual work week. But we do offer 12-hour shifts, whether it's 7 a.m. till 7:30 p.m. or 7:30 p.m. till 7 a.m. for registered nurses who are looking for a career path in supervision or a unit manager position. We're also recruiting for licensed practical nurses as well for our evening shift, which include 3 p.m. to 11 p.m. May have some day shift positions available as well. New York State certified nursing assistants, we're always in need of, for those who are looking for those career paths. So nursing personnel at this time is where we're trying to get the word out for those who are interested in joining Kaleida Health's long-term care facilities.
Mm-hmm. Now, let's say you're at a job fair, and someone expressed an interest. You take their name. Do they have to fill out an application, or is just talking to you good enough?
No, absolutely. We definitely encourage for you to be considered for a career opportunity within our Kaleida organization. A application must be completed. You can always call and inquire to see the type of positions that we have available, but in order to be part of the interview process, an application must be completed on our Kaleida Health's career page.
And on that note, I want to add, if your computer isn't working at home, or if somebody else is on the computer, what do they say, hogging the computer? The second floor at Buffalo General Hospital, there's a computer. I don't know if you have one at High Point, but I know we have a computer where you can go online and complete your application. And you know what? And bring your resume with you. And I know there's someone who can show you how to download that application. And I want to say, is a resume required for the positions at High Point and DeGrasse?
We prefer resume for certain positions that we do interview for, as far as a resume gets a little bit more in depth as past experience. So we do encourage, if you do have a resume, submit your application into your Kaleida Health profile when submitting that application. If not, you don't have to have a resume.
Okay, thank you. School is almost over, and there are going to be lots of people. There will be students graduating from many of our area high schools in Buffalo, south of here, north of here, Buffalo. Do they have to, and they're interested in healthcare, they're interested in nursing, and they're interested in applying for the CNA, Certified Nursing Assistant position. Do they have to have experience in that area to get hired? If not, what does that mean?
Experience is not required. It is preferred. For those who are interested in joining our paid CNA training program, we encourage that you submit your applications as soon as possible for our next upcoming paid CNA class. Just go into our careers page, type in nurse aid trainee for your designated location, which is either High Point on Michigan in downtown Buffalo, or DeGrasse Skilled Nursing Facility in North Tonawanda. Our classes are held at our High Point on Michigan location for 4 consecutive weeks, and upon graduation, you can go right back to your designated facility to continue working as a certified nursing assistant.
Now, what are the hours of the training?
Our training class is Monday through Friday, 7 a.m. till 3 p.m. for 4 consecutive weeks. We do have our nurse aid trainees work as pre-CNA trainees And this allows them the opportunity to work alongside of other certified nursing assistants so that they can see what they do on a day-to-day basis. A lot of people have a perception of what New York State certified nursing assistants do. So this opportunity allows them to actually see the everyday functions of the job role and responsibilities and ask those certified nursing assistants questions that they may have prior into getting into the CNA training program.
So it's like a almost a peer-to-peer observation, peer-to-peer training, where they might be more comfortable asking somebody, and there are no dumb questions, but they may be more comfortable asking their peer who they're training next to. Is that kind of the idea behind that?
Absolutely. It's, the opportunity to see what New York State certified nursing assistants do, see what the everyday job function is, have that patient and resident interaction along with our children, and it also gives the employer the opportunity to monitor, the patient interaction, just to make sure that they're a qualified candidate to be in our paid CNA training program. We're looking for caring, compassionate people who are here to make the last years of their lives the most memorable, and just make them comfortable, looking for some type of companionship for our elderly population.
Now, once someone is, let's say they're hired, they've gone through the training, but they really want to work a different shift, like a night shift. Is that possible? And what are the different shifts that CNA, certified nursing assistants, work at High Point and DeGraff Skilled Nursing Facility?
The benefits of working for our long-term skilled nursing facilities is that it is a 24-hour facility. We're open 24 hours a day, 7 days a week, 365 days a year. So it allows individuals the opportunity to pick a shift that works for them or their families. So our shifts at High Point include days, evenings, and overnights, which are 7 a.m. to 3 p.m., 3 p.m. to 11 p.m., and 11 p.m. till 7 a.m. Over at our DeGraff Skilled Nursing facilities, their hours are 6 a.m. to 2 p.m., 2 p.m. till 10 p.m., and 10 p.m. till 6 a.m.
So as you see, there is flexibility in working as a certified nursing assistant or working in long-term care.
Absolutely. So at the completion of their paid training program, we sit with the individuals to make sure we find a shift that works best for them.
Wow, that sounds very inviting. How about open interviews? Can you explain? I know you have signs up sometimes around High Point on Michigan long-term care, and it says open interviews now taking. What does the sign say? I know it says something.
So we have our upcoming open interviews at our long-term care facility. Just to put some dates out there, on June 5th, DeGraff Skilled Nursing Facility will be hosting open interviews, allows individuals the opportunity to come meet with the talent acquisition team and find a position, that fits them or that they're experienced for. June 18th, which is a Tuesday, we'll be hosting open interviews at High Point on Michigan, which is located in downtown Buffalo. And at that time, we are looking for nursing personnel, again, which include registered nurses, LPNs, certified nursing assistants, or those who are interested in our nurse aid training program. We encourage that you visit the sites during the open interviews, come in with your 2 forms of ID, a New York State ID card that is not expired, a second form of ID, which includes Social Security card or birth certificate, or a passport if you have that available. Meet with the hiring managers, and we are offering on-the-spot job offers.
On the spot, people, listener, did you hear that? It's for you, it's for your children, your grandchildren, on the spot job interviews. Could you just say those 2 dates again for open interviews and the positions you're hiring, you're specifically interested in?
Yes, for our North Tonawanda location, it will be on Wednesday, June 5th, between the hours of 1 p.m. till 6 p.m. And then on Tuesday, June 18th, for High Point on Michigan, which is located in downtown Buffalo. The Graf Skilled Nursing Facility is located at 445 Tremont Avenue in North Tonawanda, and High Point on Michigan is located at 1031 Michigan Avenue in Buffalo, New York.
And what's the time again on June 18th?
From
At High
1
Point?
p.m. from 1 p.m. till 6 p.m.
Oh, both. Okay, they both have the same times.
Yes.
Okay. Should someone bring their resume with them, or isn't that necessary?
Yeah, if they have a resume, they can bring the resume with them at that time for the open interviews. But most importantly is having that application on file on our careers page.
Okay. That sounds great. How about the Juneteenth tent? Juneteenth is at Martin Luther King Park, and Kaleida Health and ECMC for many years have been sponsors of the Health Pavilion. Are you going to be there, Angela, with career information, employment information for High Point on Michigan and DeGraff Skilled Nursing Facility?
I would tell everyone to please stop at the Kaleida Health career tent at the Juneteenth, and I will be there to meet those who are interested in seeking career opportunities.
What shift are you going to be there?
I will let
We have two.
know. I know we have two shifts, and I will get
Okay.
that information out to you as soon as possible.
Okay, and because we know Angela will be there, and if you're listening right now, please stop under the tent, because if she's on the second shift that begins at 1 p.m., the first shift begins at 10:45. But you know what? If you're just walking by, getting ready for the Juneteenth parade, you see the Health Pavilion, just stop in, ask for me, Francesca Messiah. If Angela isn't there, I will have her contact information in case you're in the parade, you're marching in the parade, and you won't have a chance to get back. So please stop under the health, the pavilion. Angela, what are some of the benefits of working at High Point or DeGraff?
Not only do we offer you a job, we offer you plenty of career opportunities. There's definitely a career ladder within the Kaleida organization for you to grow within the actual company. We offer paid time off. We offer, tuition assistance programs for those who want to further their education in different career paths, pension plans, health insurance benefits, dental, flex spending. There's so many benefits for working for the Kaleida organization. And let's not forget our employee discount programs as well.
Yes. Our employee discount program is huge. It's everything from travel to car wash, discounts to our large stores, like I call them superstores, like Sam's Club, and we don't have Costco. We have BJ's. We have hundreds and hundreds of discounts for Kaleida employees, and we have Kaleida Buffalo Bills swag. So we just have a lot of really great. There are many great reasons to join. Angela, we have around we have a couple minutes left, about a good 5 minutes. Anything I haven't touched on that you want to discuss, or something you want to reinforce that you have touched on?
I think we've pretty much touched on everything. If anyone has any additional questions, please feel free to reach out to me. Again, my name is Angela Mosteller. I work with the HR department. I am Senior Talent Acquisition Partner for Long-Term Care, which includes High Point on Michigan and DeGraff Skilled Nursing Facility. You can text me at area code 716-913-6121. Again, that's 716-913-6121. Text me regarding career opportunities, or you can send me an email, which is armosteller, which is MOSTILLER @KaleidaHealth.org.
And you know what, Angela, what I'm going to have you say your text number a little slower, and I'm going to just have you repeat your email address for additional questions.
Yes, 716-913-6121. Again, that's 716-913-6121. You can shoot me a text message or you can send an email at armosteller@kaleidhealth.com. And that's ARMOSTILLER@kaleidhealth.org.
Okay. Thank you. And I know we still have a couple minutes, so I just want to ask you a little more about this training program. So a listener doesn't have any experience, they're still wondering how can they have no experience, go through a training program and get paid. So if you could talk a little bit about that, it just seems too good to be true. If you could just share a little how that works.
So it's a paid CNA training program, which is for our Kaleida long-term care facilities. And the paid CNA training program are for those who would like to pursue a career in healthcare. And again, that's taking care of our elderly population. It's paid training Monday through Friday, 7 a.m. to 3 p.m. And we're just looking for those individuals who wants to make a difference in others' lives. Again, who are caring, who are compassionate, who are reliable, dependable, want to take care of the elderly population. Another unique thing as well is that it allows them the opportunity to work alongside of our children. High Point on Michigan has a pediatric unit that we take care of younger children as well. So it's not just elderly patients and residents, we service children. So for those who are interested in our paid CNA training program, please visit our website at the kaleidahealth.org/careers page. Type in nurse aid trainee and complete an application so we can review your application, bring you in for initial interview, provide you with a tour of the actual facility, and see if you're a potential candidate for our paid CNA training program.
And I also want to say something to our listeners. I just found out last week. Angela walks a walk, talks a talk. And Angela, how was it you got your career? You don't have to mention where it was you started, but because you had a good personality, something like that?
Well, I thank you very much. I started my career path in a long-term skilled nursing facility as well. I wasn't sure exactly what I wanted to do, but it was the opportunity to work alongside those healthcare professionals. And to be honest, I got into healthcare working as a certified nursing assistant. And I've been working in healthcare now for 26 years, a little over 26 years. And my CNA certification allowed me the opportunity to explore different career opportunities within the healthcare industry. And, sometimes you just have to follow certain career paths. And my CNA certification led me to a career path working in human resources.
And I remember when you were speaking last week to the AHAC students, you talked about being prompt, and that helped you in your career, right? Just being early, being on time for work.
Absolutely, being reliable, being dependable, knowing that my employer knew that I was going to come to work every day on time and perform the job duties that was expected from me, which are very important, when you're expressing different, interests and growing and following that career ladder within the organization, looking for dependable people, honest people who are going to come to work every day and know that this is a 24-hour organization taking care of our patients and residents. And, our patients and residents deserve, that they have someone that they can rely on and depend on to be here every day.
And Angela, and on that note, I just want to say thank you. And those are, during open interviews, those are the types of qualities I'm sure Angela is looking for in you. You, the listener, if you're interested in working at, finding out more about working at High Point on Michigan or DeGraff, remember the 2 dates, June 5th, 445 Tremont Avenue, 1 p.m. to 6 p.m., June 18th, again, at the corner of Michigan and High Street, High Point, again, 1 p.m. till 6 p.m. Angela, I want to thank you for being our guest this morning on the Great Lakes Health radio program. Thank you.
Francesca, thank you so much for having me.
Oh, you're welcome. Next week, you'll hear from my esteemed colleague, Cindy Bass from Erie County Medical Center, ECMC. I want to thank you from the bottom of my heart for listening to the Great Lakes Health radio program. And in 2 weeks, God be willing, you will hear me again. Francesca Messiah, Manager, Workforce Development, Kaleida Health. Thank you. Have a blessed day. Bye-bye.